Aphorism 223. But if the antipsoric treatment be omitted, then we may almost assuredly expect from a much slighter cause than brought on the first attack of the insanity the speedy occurrence of a new and more lasting and severe fit, during which the sura usually develops itself completely and passes into either a periodic or continued mental derangement, which is then more difficult to be cured by antisorics. Explanation. In this aphorism, Dr. Henneman has given idea about acute mental disease. But if the antisoric treatment is not given, then there is possibility of the first attack of the insanity, frequent and faster occurrence of attack with severity from the slightest cause. During this attack, Sura usually develops itself completely and passes into either a periodic or continued mental derangement, which is then more difficult to be cured by antisoric medicines. Aphorism 224. If the mental disease be not quite developed, and if it be still somewhat doubtful whether it really arose from a corporeal affection or did not rather result from faults of education, bad practices, corrupt morals, neglect of the mind, superstition, or ignorance, the mode of deciding this point will be that if it proceed from one or other of the latter causes, it will diminish and be improved by sensible friendly exhortation, consolatory arguments, serious representations, and sensible advice, where a real moral or mental malady, depending on bodily disease, would be speedily aggravated by such a course, the melancholic would become still more exasperated, and the chattering fool would become manifestly more foolish. Explanation. In this aphorism, Dr. Henneman has given idea about method of disease diagnosis. If the mental disease be not quite developed, and if there is still doubt about its origin, whether it really arose from a corporeal disease, whether it is resulted from faults of education, bad practices, corrupt morals, neglect of the mind, superstition, or ignorance, it is very important to know its origin, because if it has resulted from one of the latter causes, it will diminish and be improved by sensible friendly conversation, consolatory arguments, serious representations, and sensible advice. But if the mental disease is caused or developed from the corporeal disease, would be aggravated by such a treatment or therapy, and melancholic will become more dejected, lamenting, having more complaints, inconsolable and reserved. The spiteful or malicious mania would become more violent. So the person who gives such a therapy, who is chattering, will become more foolish. Footnote 124. It would seem as though the mind in these cases felt with uneasiness and grief the truth of these rational representations, and acted upon the body as if it wished to restore the lost harmony, but that the body, by means of its disease, reacted upon the organs of the mind and disposition, and put them in still greater disorder by a fresh transference of its sufferings on to them. Explanation of footnote 124. In such a mental disease, it would seem that mind represents the grief and uneasiness rationally, as of it has acted upon the body to restore the lost harmony. But here, body, be- because of the disease condition, has reacted upon the organs of the mind and disposition and put them in still greater disorder by transferring of the corporeal sufferings to mind and disposition.